This video is about B12 deficiency anemias. We will be going over 5 questions. I will read the question to you, give you a second to think about what you remember, show you the answers, and then we'll talk about which answer is best. If you want more information on this subject, you can find this in your hematology or vascular lectures under the anemia categories. And we're also going to be talking about the B12 supplements, the PO forms and IM. So let's get started. Question number 1. A patient comes to the clinic complaining of dizziness, dyspnea on exertion, palpitations, and fatigue that has been worsening over the past few weeks. What is important for the nurse to ask when considering risk factors for B12 deficiency anemia? Select all that apply. Is the answer number 1, diet preferences, number 2, family history, number 3, medications, number 4, and/or normal activity level? And the answers here are 1, 2, and 3. The question is just asking, do you know the risk factors? It's just a knowledge question, select all. So the risk factors that should have been coming to your mind, hopefully, are that 1, it can be genetic. The genetic type of B12 deficiency is called pernicious anemia, and that's when the client does not have the intrinsic factor that is located in the GI system and absorbs B12. There could also be GI causes, like if the client had a resection or removal of the gastric area or cecum, that is where B12 is absorbed, or GI disease in those areas like Crohn's. Maybe dietary influence if they just don't eat meat or if they're a vegetarian or vegan. Medications, some proton pump inhibitors used for heartburn block B12 absorption, as well as metformin, which is used for diabetes. And then alcohol use. Alcohol stops absorption of the B12 as well in the gut. So I highlighted genetic, GI, diet, medications, alcohol to try to give you a quick thought if you have a question like this next time. So in select all, if we true false this, number 1 was true, number 2 was true because we're looking for the genetic reason of the loss of the intrinsic factor, number 3 was true, and number 4 was false. So this picture, if you need a quick picture of the actual foods with B12, I like this picture. It shows you meats, dairy, and fortified cereals. And in the further learning, there's just one more note here that if an older adult comes in with this, it might just be because of GI atrophy, which can also decrease vitamin B absorption. Question number 2. A nurse is caring for a client with pernicious anemia due to Crohn's exacerbation. The nurse is assessing the client. Which signs and symptoms are specific only to B12 deficiency anemia? Select all that apply. Is the answer number 1, numbness and tingling in extremities, number 2, beefy red tongue, number 3, loss of sense of balance, and/or number 4, fatigue? And the answers here are numbers 1, 2, and 3. The question is just asking specific to B12 only. And so in the thought, if you were thinking the general signs and symptoms, you wanted to put those aside and just go specifically with B12. So B12 only is the glossitis, which is the inflamed tongue, but in this case it's beefy red, unlike iron deficiency, which was pale. Paresthesia, which is numbness and tingling, reduced vibratory sense, ataxia, which is a loss of balance and like a clumsy walk, confusion, and peripheral neuropathy, which is decreased sensation. So if we true false these, number 1 was true, that's paresthesia, number 2 was true, that's the glossitis in B12, and number 3 was true, that's along the lines of the ataxia. Number 4 was false because fatigue is a symptom of any anemia, and this was asking specific to B12 only. So in the further learning, just something to remember about these B anemias is that B vitamins are nerve protective. So when those are lacking, patients can have nerve symptoms like numbness, tingling, decreased sensation. We've even seen like joint pain in a situation like Crohn's when the B vitamins are low. And another point here is to make sure you can still be going between medical terminology and lay terms. If you're learning ataxia, make sure you know how to see that in your client, because you can't ask them, are you ataxic today? They won't know what you're talking about. It's clumsy movements. Same with paresthesias. Make sure you know the lay term. It's numbness and tingling. And it's a good idea to, yes, educate yourself in the general signs and symptoms that you would see in anybody with anemia, and also the specific signs and symptoms that might be for a specific type of anemia. And in this case, there are specific signs and symptoms for B12 anemias. Question number 3. Another select all that applies. So if you want to practice those, this video is good for that. Number 3, the nurse is discussing B12 deficiency anemia with another nurse. The nurse knows that. Select all that apply. Is it number 1, B12 deficiency anemia is normochromic megaloblastic, which is also macrocytic anemia? Number 2, B12 deficiency anemia is diagnosed by low cobalamin levels and a high homocysteine level? Number 3, B12 deficiency anemia can have a genetic link? And or number 4, B12 pernicious anemia is treated with those B12 oral PO supplements. And so this is just a knowledge question about what do you know about deficiency, B12 deficiency, and numbers 1, 2, and 3 were correct. So the thought was anything around the risk factors, diagnosis, treatments, and if we true false these, number 1 was true, number 2 was true, and number 3 was true. Number 4 was false. We cannot treat a pernicious anemia with supplements because they don't have the intrinsic factor to absorb it. Pernicious anemia always has to be treated with IM injections. So let's go over some of this stuff in the further learning. The labs that are relevant to B12 deficiency is, of course, the low hematocrit and hemoglobin. That's always how we know anybody's anemic. But specifically with this one, cobalamin is B12. So that's how we check the serum level. So that would be low. And the word normochromic in number 1 refers to normal color. Chromic means color. And that is seen when looking at the blood under a microscope when you do the peripheral blood smear. And the color would still be pink. So the only one that is pale is iron deficiency. So all the other anemias are normochromic. And then that word megaloblastic or macrocytic, that means that the cell is big, and that is discovered by doing the mean corpuscular volume. That will be high, above 100, and that just tells you that the cell is big. For some reason, the lack of B vitamins causes cells to enlarge in size. And then the homocysteine level, that is, it's removed in the body through a B12 pathway, and so when B12 is lacking, the homocysteine increases in the body. So that's a way to diagnose. If that's above 20, that's another indicator that this is a B12 anemia. Number 4, a client with pernicious anemia is to begin B12 supplementation. Which order would the nurse expect? Number 1, monthly vitamin B injections will be necessary. Number 2, take a B vitamin complex by mouth every day. Number 3, increase B12 fluids in the diet. Number 4, every 3-month injections of B12 will be necessary. And the answer here is number 1. With pernicious anemia, like we said a second ago, that has to be IM. If you increase GI sources, it still won't help because they can't absorb it. And for that, it's 100 to 1,000 micrograms monthly IM injections, and it's going to be for life. So number 1 was the answer. And we're just going to take this opportunity to also talk about that medication and review the dangers and duties of B12 medication. So the side effects, they're not really terribly serious, but if for some reason there's an overdose, the client might get a headache, nausea and vomiting, diarrhea, fatigue, weakness, tingling sensations in the hands and the feet. It's kind of hard to overdose this vitamin, but it can happen. And my nursing duties are really just to remember that pernicious requires the IM injection since the patient can't absorb the B12 through the GI system. The other people that might need it as well are people with GI issues and disease. Those people, oral supplementation might not help either. So people with resections, Crohn's disease, malabsorption syndromes, those people would need IM sources as well. If they don't have pernicious or they don't have GI malabsorption issues, then the PO sources will work for those people. Question number 5. A client who is vegetarian and with B12 deficiency anemia is advised to take supplements and increase vitamin B12 foods in her diet. What foods would the nurse recommend? Select all that apply. Would you recommend number 1, eggs, 2, chicken, 3, green leafy vegetables, 4, shellfish, 5, fortified cereals, and or 6, milk? And the answers for this client is numbers 1, 5, and 6. So the thought here, it was just a knowledge question on B12 foods, but you had to pick up that she was a vegetarian. So we don't want to recommend any meats. Vegetarians, unless she was a lacto-vegetarian, which this doesn't say she is, so vegetarians will eat animal products like eggs and dairy products, and then they can increase with fortified cereals as well. And hopefully it says she's going to take supplements. So number 1 was true. Number 2, even though it has a great source of B12, it was false because this client's vegetarian. Number 3, green leafies don't have B12, so that's false. Number 4 has B12, but again, she's vegetarian, she won't eat that. Number 5, true. Number 6, true. So 1, 5, and 6 were the answers. Again, further learning, very important to pay attention to specifics in the question. Who are you speaking with? That may influence your answers. So if she wasn't vegetarian, other sources that she could have eaten were meat, poultry, fish like tuna, clams, mussels, oysters, so all your shellfish. Vegans would not be able to eat any of the animal products, but they could use a non-dairy source of milk and that would still have B12. If they are taking the supplements, we just need to make sure they're taking 25 to 2,000 micrograms orally per day. Some other things to consider, make sure that they do not take their B vitamins with vitamin C because it can delay absorption. So vitamin C should be taken 2 hours after a B12 supplement. And we have to watch out for those medications, metformin, proton pump inhibitors, and colchicine. That's used for gout that can interfere with the B12 absorption. So final thought here in the picture, this picture is actually wrong. So what is wrong about this picture? And it says that this picture includes spinach. Spinach, which is a green leafy, does not have B12, but all the other ones are correct. So don't know if you caught that. Okay, that's it. Hope you feel more educated on your B12 anemia, the pernicious type versus the dietary type of B12 anemia, the risk factors, the specific signs and symptoms to B12, like those nerve signs and symptoms, and your treatments and your food sources. You know, they like to ask you about dietary sources. If you like learning through questions and critically thinking, there's more videos like this on our channel, so please subscribe. Don't forget to like this video, and you can always find us at sciencestrategies.com.